Okay, we're recording. So we have Dr. Williams and Dr. Brundage from the VA SCI Hospital, and today we're talking about some healthy habits for our mental health while we are in isolation and social distancing ourselves, which is kind of a new norm for a lot of us. And we're just looking for your advice on ways to keep ourselves engaged and in a positive attitude while we all deal with this.
I'd be interested to know if there is anything in the books about something like this. Has there ever been any review or discussion about something as crazy as this is?
Actually, we just finished an article writing about all these things, and there have been a good 8 or so of these in the century we just finished. As you know, starting with what was commonly called the Spanish flu in 1918. And there was I don't know how many of you listened to NPR, but there was a wonderful interview between a 107-year-old and a 100-year-old, and they were remembering how the 1918 Spanish flu affected them. And the older of the two said he lost a neighbor across the street, remembers those kind of things, and them being forcibly quarantined in their homes. So most of us on this call aren't 107, so we didn't live through that one. The great polio outbreak started actually before the Spanish flu and didn't hit its peak until the 50s and began to wane a little bit in the 60s. And certainly that was the next one that was I'd say we really didn't understand how it was being spread in the beginning. And that has commonalities with what we're going through now. You're all well-trained service personnel, and you know that the way to defeat an enemy is to define it, understand its characteristics, and counteract every single one of them, right? We don't have any of that. And we didn't have any of that for polio. Over time, we began to understand what was happening with polio, and the vaccine came out and the numbers began to come down. But what we know about this particular virus is that it's like all other viruses, it continues to mutate. There are half a dozen or so different strains. There are reports now out of from China and also from South Korea of people having been positive, got better, and are now positive again. So that's a unique characteristic of this one. Typically, when you get the flu, you get it, you develop antibodies, and you don't get that one again. You get one of its cousins, but you don't get that one. So we really don't know about all the characteristics with this particular virus. The other one that I think all of us were alive for on this call was the HIV/AIDS outbreak. Again, as it developed, we really didn't understand how it was transmitted. We didn't understand why people were getting it. We knew a few groups were more prone to get it. We certainly didn't know how to treat it. I was actually an intern at the VA when it was really bad, and we were actually trained in how to figure out who was going to survive and who wasn't. I mean, that's how grim it was. We just knew if you got it, you were going to die. It was just a matter of when. So there's some characteristics there. So we've actually been through a lot of situations where there's a disease and we really don't know how it works, and we're trying to figure it out as we go ahead. All those things are a little bit disconcerting, except that we know that all these things are spread by close contact, and so the social distancing, it's one of the best things we can do. Probably almost everyone on this call has practiced for many years now how to be clean and safe. You get to do that with your catheter and with a whole bunch of other stuff. That's all new for the rest of the world. I mean, here comes recreation, maybe.
Oh, hi, sorry.
Yep. So I think as a group, we're probably ahead of the rest of the community in terms of understanding what to do to protect ourselves. And that's an advantage. When we talk about communities living with disabilities, we talk about you know, the relative disadvantages that they might have in society. I think many of you know my daughter has a autoimmune disorder, and she joked to me the other day, and I said, you know, it's great after 20 years I've learned that my lifestyle is called isolation, social distancing, quarantine. And I think for many of us, we're in that same situation. We've been careful for a long time. We know how to do that bit. The part that's harder for us is you know, we've all worked to connect socially, and now some of those connections are harder to pull off. What we're doing now is what we see in the literature. It's the primary source of people getting together is through Zoom and other similar technologies, people's iPhones and FaceTime. Those have been very, very successful. If we talked about the historical nature of these things in the past, that those things didn't exist, right? We had radio broadcast, and some people had phone, and not everybody. But we're in a unique position in terms of being actually able to see each other and see reactions. So that's the background stuff. Dr. Brundage has been working with employees here. You know, we hear a lot about the news. As you know, the VA constantly practices readiness. One of the PVA's main emphasis in reviewing our programs every year is to check our readiness. Are we equipped, and are we staffed, and are we ready to address the needs of the people we serve? And so we get extra oversight, which is good. But the rest of the hospital also does contingency planning on a regular basis. So we're actually in better shape than some of the community organizations because they don't practice readiness. You know, we're back up to the Department of Defense, as you may know. And then there's this funny thing called the fourth mission, and probably some of the leaders in PVA know about that. Our fourth mission is to back up the community. Here in Milwaukee, we are not backing up the community now. We haven't had that request. Hines is. They do have a few patients that they're taking care of because, as you know, Hines is a little bit of a hot spot. But you know, as Dr. Lee told you last week, we're good with beds. We're good with ventilators. We're good with specialty beds, those being ICU level care. And then as you guys probably have heard, our regular admissions are being held so that we have capacity. And right now we have capacity. So on the healthcare side, we're prepared as well. But you know, the staff gets to deal with some of these things on the front line. And so Dr. Brundage has been helping out with staff. My role is more on the administrative side. I think many of you know that I'm the ethics consult coordinator with Dr. Gaudet for the facility. And so then we participate on those agency level committees to make decisions and make sure we have enough resources for everybody. So those have been kind of our roles. We continue to remain available to you. Our VVC services have been going. I think we probably talked with Dr. Lee last week. We're continuing to do annual exams by VVC. So those who can connect, it's different exam, as you might guess. But you know, we're still connecting and trying to do those things. And then you know, all the other things. We're also available by telephone. So that's the two main ways that we're available. Dr. Brundage and I are still doing bedside work. I know that has been halted in some places, but we continue to see people at bedside. So be assured that if there's someone here in the hospital who has a spinal cord injury, we're able to go see them. We do try to minimize the number of people who are in the room at the same time and the number of visits per week. And so sometimes we'll round with the physician so that there's just the two of us coming in once versus, and that's primarily for protection of the patients that are here. The fewer people that interact with them, the less chances of contact with the virus. So we're doing those things mostly to take care of them. So any questions you might have about maybe some of the things we're doing or some things that you've struggled with in general that you could use some tips for?
Absolutely. Just to dovetail on what you were talking about with the annual exams and not being able to facilitate everybody through the telehealth program, we were launching a Facebook portal program about 3 months ago. And it looks like the VA has finally come around to our way of thinking, and maybe you guys can use those devices to help facilitate the annual exams. If so, let us pour kerosene onto our program and get those portals, Facebook portal devices out to the people who need them. If that's something that the VA in Milwaukee is ready to support, not only for annual exams, but for peer group support as well.
And the other way means is by telephone. There are some people who just, I think one of the things that's difficult is that we don't recognize that there are multiple levels of technology that people might be using. And so some people just have a landline, and we're able to help them do their annual exams by telephone. So, pretty much whatever means works. We have had some difficulty with platforms that are not through the VA. As you know, we have an incredible firewall that catches not only bad things, but things we want to get through. So we have had a lot of trouble using some of the other technologies. Zoom is working pretty good today. And our VVC system has worked pretty good. As some of you know, if your internet connection isn't that great out there, then it's not that good here. And the way we've handled those things is we connect like we're doing now, and then we keep the picture going. And if the sound's no good, we give you a call. And so then our audio is clear that way, and then we can keep the visual connection. Some VAs have gone very strongly, Scott, to the kind of things you're talking about. And so they have a little more experience with some of the hangups, but it seems the main is the firewall, and sometimes the things that have to be downloaded, our computers prevent us from downloading things. And so that there have been some hangups there, but I do think on the other side of this that we'll come up with some more solutions from the smarter folks on the computer side to solve some of these things, because there are just a number of people who don't have any computer access at all. Maybe they go to the library to log on kind of thing, or they just have a telephone. Even their cell phone reception may not support video. So those are some of the things we're working with, and I assume there's going to be more coming because not only us, but all the other divisions are doing business in a different way, and so people are asking for more resources and more ways to do things. So from what Dr. Brundage and I are hearing from the national work groups that we participate in, more stuff's coming, and it's been, it's always a crisis, right? In the crisis, we learn the skills we need for that we probably should have been doing all along, as you're saying. So this is just it's just an opportunity for us to figure out how to do business differently.
And in the military, we always said we train to fight the last battle.
Yes.
So.
The one I always misquote, adapt. What are the rest of the words?
Overcome.
Overcome.
Yep, that's
A few more words, but we probably shouldn't mention those in mixed company.
That's right. That's right. Yeah. Yeah.
What doesn't kill you makes you stronger.
Yeah.
Except artillery. Artillery kills you.
Yeah, that's right. On your other thing about Mr. Griffith, Mr. Matthews has been connecting with patients in the hospital, which he can probably talk to you a little bit about through peer support, and he's been doing that with the assistance of rec therapy. So we have a new was a new rehab, I believe. You talked to Mr. Rehab, Mr.
Yeah, we did it through VVC.
So is this Zoom platform something that Ken can use and to facilitate a larger peer group session?
I know we can do more people through VVC than we used to do. So those are things to probably try to figure out. I don't think we have a definitive answer that we'd like to share, but I know we can do more than one person in VVC. Dr. Brundage helped figure that out some months ago, so that's an option for us. And then of course we use the Vance line, so people can call in by telephone if they don't have video. But when we do, when Mr. Matthews was able to be here physically, we did connect with VVC and through a Vance line every week. So people are able to hook up that way. Mr. Matthews looks like he wants to say something. Are you getting ready to speak?
Well, I was going to ask Dr. Brundage what sort of things she's running into with the staff.
I don't necessarily know. I mean, it's just general self-care things, how to manage different stressors and how to remember to stop and pause, take care of yourself. There's actually a quiet zone in the library, which I've been helping out with, where staff, during their breaks on their shift can go and just chill out. It's a very quiet space. There's some windows, some light. So we're really encouraging staff to take those extra steps to kind of pause, think about things and again, just a lot of self-care, and we're seeing, managing stressors at home, similar to probably a number of you have had to sort of manage things with caregivers or, access to food and to, all the necessities that you sort of need, employees are kind of dealing with that as well. So really just some basic sort of problem solving, stress management stuff. They're just nice reminders, I think, of things we should have probably been doing all along, but become even more important now in times of high stress and, high chaos, a little bit of chaos, things like that. But I think overall we're, employees and staff here are very much supportive of one another, and we're kind of learning from one another and leaning on one another. So it's been nice to see, people kind of coming together, and kind of, again, sort of supporting one another. Because we can't, that's the one positive of coming into work every day is you do have, access to colleagues and being able to check in with one another. I know other colleagues at other VAs and in other sectors, if they're teleworking or working from home, similar to you guys who are kind of stuck at home, it's just takes a lot more effort and a lot more coordination of video visits or phone calls or text messages. Whereas those who are still kind of reporting to work still have that natural way to sort of connect. So.
And I would just add that most of us feel safer here than we do in the community. And I know sometimes that message doesn't get out, like in the news. You know, you hear people worried about working in certain situations. You know, all of my colleagues know how to be safe. And so I'm actually safer here than I am in the local grocery store, because the people around me are doing the right things by and large. The things I have seen is the grief and the shock, right? Because you know, even though like in the news it says, you know, the flu is more deadly than this virus has been, but it's not this fast. You know, the flu typically doesn't spread across the country at the speed that this virus has, and so I think that's the shock part. Where people we went from one way of doing business to a completely new model in a matter of days. So I think that's been hard for people. You know, the dirtiest word in the English language I can actually say on Zoom. It's not what we learned in Sunday school. It's change. Change is just so hard for every single one of us. And if you don't believe that, put some cones up in front of your favorite church that you like to attend and make people park in a different place. And you'll see people lose their religion like you could not believe.
I think a big concern for our community and our national organization, PVA National, is closely advocating with other disability groups. There's a concern in the disability community that, you know, worst case scenario, when respirators start getting rationed and they're not made available to persons in our category.
Right. So that's an excellent question. I'm glad you asked that. So one of the things that all VAs are required to have is a scarce resource allocation and triage teams. So the scarce resource allocation process was actually developed in 2010. So it was developed in response to the last great flu outbreak that we had. I believe it was 2008.
SARS.
Yes. And so all that fancy talk is there's a system by which patients are triaged, and then decisions are made based solely on survivability, not on disability status, not on race, not on gender, not on economics, none of those things. So, so if we got into a position where there weren't enough ventilators, for example, the decision on who would stay on a ventilator or who wouldn't would be determined solely on their likelihood of survival. And those are all medical indicators that have nothing to do with disability status. So the number of organs that are failing, right? Those kinds of things. The decisions we would typically use, or the things we would typically look at to see whether someone was going to make it or not. So it's not based on it was, and you've probably seen in the news. I mean, I've read the same things because I have to stay on top of this. Is that there are some hospitals that made decisions based on age, for example, or based on disability status or whatever those. And our system here is the complete opposite of that. We're only looking at whether a person is able to survive, and only in the situation where there wasn't enough resources to address everybody. We're in really pretty good shape here in Milwaukee, and in our VISN. Are you guys familiar with that talk? Our VISN is, of course, Madison and Chicago and here and up by Iron Mountain. We actually are pretty good with resources. We have yet to meet capacity, and we have ways of developing extra capacity. But we're looking at expanded capacity even at our VA of about 3 times the ICU beds as we normally run. So that's why we stopped the other kinds of admissions, was so that we could switch over to this ICU model. And then there's sufficient ventilators and all the rest of that stuff to support that many ICU beds. So it would be only in a situation where there weren't enough ventilators to go around, or there weren't enough some other critical thing that those decisions would be made, and again only based on their chances of survival, and not at all based on some of these other things. Dr. Brundage found a guidance document. I'm blocking on its name. What was that from the APA? That was a position statement that was specifically talking about the inappropriateness of using disability status as a reason to decide to provide care or deny care. And then again, I think we're in a little bit better place in the VA, because if we denied care to people with disability, we could close up shop, because almost everybody we have has a service connected something.
Other questions or concerns? Or things that are going well? That's the other side. I mean, and part of this, is we don't have to just talk about the doom and gloom, but really,
What's working?
Getting lots of yard work done.
Yeah, that is the name of the game for people who are getting projects done, as long as you're not painting or using supplies that aren't available anymore.
I found it real helpful to stay connected by phone or computer with people, and to check in with them and see how they're doing, particularly old friends and people that I've known for a long time, other people that I'm socially connected with. And that's been a big help, because everybody's kind of in the same boat. They want to talk to people, or they like talking to people, and at least connecting a little bit. So that's been a big part of my protocol every day, is to make 4 or 5 phone calls at least.
Yeah, I've heard, some people are connecting even more, because in the past they would just kind of run into people, when you saw them and you chatted, but there's more of an effort. Like you said, Ken, you're reaching out to 4 or 5 people. Even people, at least one new person a day, or, someone you haven't called in a while, or like you said, kind of an old friend, or, someone in the community. I think that I've heard that definitely being really helpful, and having really great conversations, nothing to do with COVID, like just kind of catching up. So something you might not have done if you weren't stuck at home for long periods of time.
We
Quiet group today.
say again, Ken?
We have a very quiet group today.
We do. I don't know. I must be impeding on Kevin's nap time. But
No, we're. I think everybody's coronavirused out. We've been in how many meetings and beat this thing to death. And it is good to hear, though, that they're slightly catching up on the meds and the supplies, though, at the VA.
Mm-hmm.
So I think that will continue to improve as the supply chain goes along.
Yeah, your census is larger than our membership, but we've made an attempt to reach out to our entire membership to check in and even assign them a kind of a battle buddy, one of the board members, if you will, to address any needs that they have. We're finding that, we have members who are geographically displaced in New York, in Kentucky, and in various places that are PVA Wisconsin members.
We've done the same thing here in Texas, as far as distributing out to our board, a list, names from our membership and that. So, and folks have been really, really pleased to hear from us. And on the national level, we've reached out, some of the committees have reached out to donors and to folks, and they're just very appreciative of the hello, and checking in on you and that kind of thing. So, I mean, if anything, it's as much as it's distanced us, it's brought us together, unfortunately, and kind of changed our focus. We're focusing now on, at least we have the time to focus on things a little differently now. But I can't say I'm calling my family more often. I'm having more Zoom meetings, but my family would probably love to hear from me more. But it sounds like you guys are keeping everything well afloat there, and I really appreciate the staying hands-on with the inpatients. I mean, I cannot even imagine, the isolation that would be on the unit. I mean, you're right there with them, but yet you can't go in and see. So I'm going to try to figure out how we can get down to San Antonio, over here to our unit on, we have San Antonio and we have Houston. So right now there's no visits, no, they've shut it down except for, if you go to the outpatient clinic, that kind of thing. So we're going to figure out how we can let our guys and gals know that they're not alone in there, and the staff. So you guys keep up the great work, and thank you all for inviting me. I'm gonna go back on mute.
That brings up a question. So the inpatients have that mobile robot computer device that can come into their room. Can they use Zoom with that device or Facebook messaging?
Yes, Aaron, are you still on there? I see the light up. What Aaron and company has been doing is assisting people with FaceTime with their own cell phones, and then also using, they have some equipment that freestands a little bit, and so they've been able to Skype and other kinds of things. So rec therapy really has stepped up in terms of helping people communicate with their family members. We even had a family meeting at bedside this morning using similar technology. So, in that realm, more to your question, Mr. Griffith, was that we're at bedside, we're using everything we possibly can to help people connect, from dialing phones to helping them FaceTime to, whatever the family needs or whatever they need, so that they can, see and communicate. And I guess that's the part that would lead me to the next thing, is that, like Dr. Brundage was saying, that it's difficult to measure the way that we inspire and impact other people. And I think it's one of the things that we can all do, is just to simply reach out to people. We don't have to say anything fancy. We don't have to say anything perfect. In fact, some of our most important things that we do with each other is just to be us, the quirky, weird, odd things that we are on this earth. That's what people need. They don't need anything special. They just need you. So whatever you bring to the table, whoever you are, when you connect with those people in your life, that's the medicine they need. They don't need all these other things. They just need contact on whatever way that we can. And I think it's important that we keep in mind the power that we have to heal other people just by reaching out, just by sitting. Mr. Matthews will tell you sometimes he just sits with people and they don't really talk.
Mhm.
And people don't think, well, that's not peer support. And in fact, really, it is. You know, just being with someone sometimes is the most powerful thing we can possibly do. So I just want us to keep in mind, we don't have to do things perfectly. We don't have to have a script, or we don't have to, you know, have figured out what we're going to say to that person. Just reach out and just be ourselves. That's exactly what they need. Like you're saying, we're all COVIDed to death. Yeah, we don't want to hear about that. We just, you know, want to hear about, you know, what's coming up in your yard, and did your tulips freeze the other night? You know, all those kind of things. Those are the things that are the fabric of our society and what holds us together. Our shared humanness, if you will. That's the important thing. Mr. Reek's always telling me all year long. I don't think I'm speaking out of school here, Mr. Reek, but he loves serving snacks at Vacation Bible School through his church. You know, and that's the happy thought, because every time I see him, I want to know what's going on with that, because I know what that does for him, and I know what that does for the children. And we think of serving snacks as that's not really a big thing, you know, but it's a big thing for Mr. Reek, and it's a big thing for those kids, you know, and so, you know, if passing out crappy Kool-Aid and cookies that were probably made 10 years ago, it brings joy and happiness to people. You know, our connection with each other is a lot more powerful than that even. So I don't want us to think we don't have very much to give another person. You have everything. You are the best gift that you can give another person.
Dr. Williams, on that note, we don't even know if we're going to have Vacation Bible School this year,
Yeah,
because things being canceled.
yeah. Yeah, you were one of the first people I worried about when everything started shutting down. I'm like, how's this going to work out for Mr. Reek?
Yeah, because they canceled Palm Sunday.
Yeah,
We serve brats and hot dogs, and this year our pastor makes this awesome pizza, and we were going to serve pizzas. Well, that got canceled. Now, everything for the VA that I was going to do got canceled. The Golden Age Games,
right,
camp out in Denver for Paralympic tryouts,
right.
for curling. Everything's getting canceled. You know, what's our life going to be like next?
Mhm. One of the things we know, we're going to figure these things out. The reason I talked about all those other diseases is that they were horrible at the time, and we figured them out. You know, even my favorite joke is about heart attacks. You know, used to be when someone had a heart attack, you got ready to bury them. Now, if you have a heart attack, make sure you swing by McDonald's and get yourself, you know, a Big Mac or something, because you know after they get through with the cath, you're going to be hungry. And that's just been in my lifetime, you know, that things change tremendously, and we're going to get on top of this, and we're going to figure out how to do all those meaning-based things that are being canceled right now, and maybe figure out how to do them even better in the future. Because you know, there were some, you know, if you look at all those situations, there were situations where you know, maybe we shared food in a way that wasn't the healthiest, or we did whatever, and this will help us do better with some of those things. It'll provide opportunities for us to reach out better and to have more than one plan, right? I mean, a lot of these things that you're talking about that got canceled, there was only one way to do it, and this is going to teach us to come up with other plans, so that it's not just dependent on if we can get together, this thing will happen, or if we do it like we used to do, it'll happen. We figure out a new way to do some of these things. Like Zoom, Zoom's user base was pretty small until a couple of weeks ago.
Yeah.
Now, churches are using Zoom. My family used Zoom to get together on Easter. We're using Zoom now. These platforms are going to improve, and that'll help us.
Yeah, this is my second Zoom of the day. So, speaking about what are you going to do next with the PVA for our members, as soon as it's safe to get us and our members together again, we will put some kind of program together so we can all enjoy each other's company and make us feel a little bit more normal. I can guarantee you that.
Yeah.
Right now, it's important to just keep on moving forward, as they've been saying here. The mental aspect of today's discussion is important. Most of us are pretty accustomed to probably not having a lot of social contact. We're stuck in our chair most of the time, and hopefully someone will stop by or we'll get out. But we're pretty used to being there, but others aren't. And it's important to reassure those people that life will continue and things will get back to normal as well. I would recommend that people don't listen to the news quite so often, limit themselves to how much they listen to. And as much as we feel we might have been COVID-19 to death, I think that these meetings are very important,
Yes.
Especially for those of us sitting here and the people that we talk to. We're getting them good information that's solid and supported by our doctors. So I think that we should continue with that and can continue to look at this as a positive thing. And then we're also going to have to start discussing at some point how we are going to reintroduce ourselves back into the mainstream.
Well said.
Yeah, agreed, totally, Dale. Carl Blake shared with us, I think either yesterday or the day before, that that he had heard from, it was either Harvard or Yale, that they're saying that we may not be fully through this thing until like 2022, May of 2022. So, I mean, we're going to have to figure out how to adapt, overcome, and improvise, for the lack of another another phrase. Once we get the all clear to start getting back out in the community, and maybe wearing masks for a little bit of time. As you guys stated earlier, we're well educated on cleanliness, or at least less germs, more of your own, less of somebody else's. But it's going to be a new role for us. It's going to be a new way to push and a new way to roll forward in life. I mean, we're survivors. I mean, we've overcome this. We've overcome the change that our injuries and illnesses have given us. So just grab hold of that and push forward. So I'll get off my soapbox now.
It's a good soapbox. We have just a couple minutes left. Anything else anybody has for as they say in Wisconsin, for the good of the whole?
Well, I just really appreciate your coming on and kind of covering some of this stuff. Where is the population of the unit right now? Is it down pretty much?
Yeah, we're about fourth of what we typically run.
Oh, okay.
But we're still taking patients that need fairly acute medical care, and if we were to have a new rehab, we would take them too. It's just the respites and the elective kind of things, or people who would be more at risk to be admitted here than to stay home.
Or doing elective surgeries and stuff like that. Yeah.
Right. And there's even some procedures that are being recommended to be waited on because they're more elective, just to minimize people's risk. So we might have been maybe a little more aggressive with like, familiar with the term endoscopy, and when we send the camera down your throat to look around and stuff like that. Some of those things we're holding on if it's not an emergency, but any emergent care we're go ahead and providing. It's just the things that could safely be delayed, we'll delay those because you know, our situation is a little bit. I've been to the Houston spinal cord injury unit. We're kind of similar to that, a little bit similar to Memphis, if you've been over to Memphis, and also to Hines. Our building is separate here, and so we have the ability to keep our patients away from that general population. So we're not even close to the floors that have COVID patients, and all patients are being tested upon admission, so we know where people need to go to be safe. But once they leave this building and go over to the other building, you know, there's increased risk of exposure. So we're trying to take care of everything we can here.
Thank you very much.
You're welcome. Thanks for all you do. I know you folks are all reaching out and making a difference, and that helps a lot because you touch lives that we can't get to, and we appreciate you doing that.
We try, and again, just to not to overstate the obvious, but if there's any barriers that we can help break down for you and hit the easy button as opposed to the VA way, please let us know.
Yep. And in fact, the weekly snacks have done more for patient morale than you can imagine.
All right.
It's just, you know, like you think that's just a little, it's back to the, you know, Mr. Reek's favorite thing to do, hand out snacks. You know, it just changes morale instantly. It, you know.
Good to hear.
It's good to hear that we're still being relevant. Well, that's 3 o'clock, Scott.
All right. Thank you all.
Thank y'all. Bye.
We're good.
Love that hat.
Thank you.
Nice to see y'all. Oh, nice, Dale. Like that.
Take care now.
Bye, everybody. Stay safe.
Bye, y'all.
But
Thank you.
Bye, y'all.
mhm.